Chris Rogers, County Board.
Mike Boyle, County Board.
TJ Morgan, County Board.
Nate Pankuk, Operation Youth Success.
Sean Kunther, Juvenile Assessment Center.
Mark LaFleur, Douglas County Youth Center. Brad Alexander, Youth Center.
Patrick Bloomingdale, County Administrator.
Kim Bolo, County Clerk.
Did you want?
Sorry.
Come back over there.
Pam Murphy, County Administration.
Mary Bisick, Juvenile Probation.
On the wall, the public, you can state your name if you want to, you don't have to, but staff people don't go around. You want to state your name?
Carla Dash, Operation Success. Catherine Ball, County Administration. Joanne Carlson, County Administration.
Ed Walsh.
Terry.
Luis Jimenez.
Go ahead. Okay, we'll go to brief updates. Brad.
So the data is that, well, we have 83 today. We averaged 83 in the month of March. So January through the end of March of 2019, the average daily population was 83. The length of stay is 23 days. And we're on track to admit 972 kids based on the first few months of this year. The Parent-Teachers Conference we had in January, we had 34 parents participate. The next one's scheduled for the week of April 15th. We've had 3 kids graduate so far this year. We're adding incentives for positive behavior for the youth. Buffalo Wild Wings has stepped up. Godfathers has stepped up. We're providing earbuds for the kids. That we have a behavior management system, and the highest level is level 4. And so earbuds, these radios that the kids have access to when they achieve the level 4 status. We're having to order more, which is actually a good problem to have. So hopefully that will continue. The career fair for the kids is scheduled for April 26th. Again, that's an opportunity for them to get introduced to some employers and other people in the community that can certainly encourage them and in some sense mentor them, and hopefully provide them information about opportunities that they may not have otherwise considered for themselves. Yesterday we had our first, well, technically I suppose our second, but really our first parents meeting. Commissioner Morgan and Commissioner Kraft attended. 6 parents attended. I thought that Mark and Cindy McCorder, who kind of she's our family liaison, I thought they just did a fantastic job. I think the information that was provided to the families was well presented. It ended at, what, noon, I think, or something like that. One of the parents stayed around till about 1 o'clock just to have further conversations. So it was really nice to have that opportunity and engage with the parents, and certainly made it clear that their voice is important, and we are always a work in progress. We're always trying to get better, and their input's going to help us to move in that direction. So the next one will be May 6th is the next one that's scheduled right now. Mark was going to meet with Dr. Zuha today in regards to the UNMC, Charles Drew, Creighton, and DCYC project. I don't know if that meeting happened, did it? Well, yeah, he actually is in flight right now, but we conversed a little this morning. And the plan is to, when he returns, to put together a schedule of when he's going to be there and tie that together with our treatment team meeting and going from there. But he's excited and ready to start. Of course, Dr. Pope was part of the initial contract, but she's doing a relocation, and she's made a suggestion for a second individual to fill in. But in the meantime, the plan is for Dr. Zuha to pick up those additional hours that she had. And the last thing I have is that we've been having conversations. Commissioner Borgerson has kind of hooked us up with these people, but Voice Advocacy Center for Dyslexia. And we're working to put together a 90-day pilot, which will give us an opportunity to, I think, better understand the extent of the problems or how many of the kids that we work with experience dyslexia. And then we would have somebody that would be an expert in that area to help us to work through those issues with those kids. While those conversations have been going on, we've also been talking to the State Department of Education, because we believe that they probably have some sort of a responsibility to provide services for these youth as well. And just got an email, I think, today, and they do. They do have a responsibility. They're sending us some information on how we go about screening the kids, and then once we've identified a child that has dyslexia, they have people that will assist us in working with those youth. So we might do that for the 90 days in collaboration with the Voice Advocacy Center. There will be a fee for that, but that will be reimbursed by the State Department of Education for the work that the Voice Advocacy Center does.
And also thanks to Commissioner Kraft for coming to the parents' meeting yesterday as well.
Yep.
And the parents really appreciated your willingness to accept questions from them. That really resonated very well. So thank you both.
We were glad to be there.
I was curious why the parents was there. Did anybody talk to you about I hear about it, but I haven't asked real depth because other things been on tape, like the visitation policy thing. Was that an issue
No.
anymore?
No, it looks like, at least that didn't come up.
Okay.
But we surveyed all the parents, and we also told them if there were any directions or concerns that they had to include that on the survey.
Okay.
So once we synopsize that, we'll have a clear picture, but there was no direct correlation to that.
Okay. So, I don't know if it'll come up later, but while you're there, you all want to just discuss this training you will go to so everybody's aware of it, and the purpose of it, this, or
Oh,
this letter, so yeah.
the juvenile justice train the trainer.
Yeah.
It's an opportunity for both Carla and I had to submit a request and for the grant proposal in order to pick up another person to go. And it's a train the trainer to give us insights on how we can serve the community and direct individuals to other resources that can be available, and also to confront issues that may be part of what are obstacles to families in juvenile justice, and provide some insights that can assist them along the way. And we'll be going May 5th through 8th, and go through the train the trainer, and then when we come back, we'll look to provide additional training for others. And Carla, anything?
Yeah, I think part of the curriculum involves adolescent development and working just, with the professionals who serve on juvenile justice matters.
That's it.
Train?
Yeah.
It's Facebook, they wanna know what we're doing.
They already
They
know.
always.
Yeah, they already
Already know.
So, it's a Casey initiative, right?
It is.
And so this ties to JDI, and basically, once they do this, it's a part of trying to reinforce things in the culture that are consistent with the process and things of that sort.
That's correct.
Okay.
Yes, sir.
All right, no, I just want everybody to know about that, because it's pretty stiff field, my understanding, to get that, so.
Yeah, well, it's a coup for us to get it. That was great. There were quite a few applicants, and the neat thing about this, Carla, for the most part, is free, but it has to be with a paid person. So we're glad that worked out, and I'll be talking to you about that later.
So Carla isn't going free? Just kidding.
Free is such a relative.
Any questions? Anybody else? Okay. Sean?
All right. I'm gonna hand out our annual numbers, and then the quarter that's listed on here is last quarter, so not the quarter that just ended March 30th, but the quarter of October through December. And you can just see there that there's quarterly comparisons to the year before, so that you can just look at trends. Page 1 is the page that has the narrative on the bottom that describes what the purpose and function of the Juvenile Assessment Center is. And you see there, all youth referred to the JAC for delinquency charges and the breakdowns there, the number of youth assessed, and then on the back, you'll see youth placed on diversion, again with the breakdowns, and then toward the bottom there, you'll see total youth diverted from the system in those time periods, as well as the other special populations we serve, which are youth impact, or those dually involved youth in child welfare and juvenile justice. Status referrals are parents who are calling asking that their children be court involved. And then the truancy referrals, I just want to give a quick update on truancy referrals. Again, that was through December 31st that we had received 412. As of today, we've received 855, or the county attorney's office has received 855 truancy referrals for this school year. Just a quick update on that number that I have. Any questions on the data, and I'll just give you a little update about the JACs. Yes?
Excuse me. You use a rating system, do you, to determine who goes where and all that kind of stuff, and you have points?
We use the YLS risk and needs assessment,
Okay,
and then we also use a behavioral health screening.
okay. Is that pretty tight? Do you waive it anytime, or do you overrule it, or you decide somebody maybe looks good on this, but they're really not good, so you do something to them?
So how?
Pardon me for putting it
how
that way.
That's okay. I was trying to think how to respond to that last part there. So in the YLS assessment, that will score anywhere from 0 to 30, basically. And that helps guide us in the number and sort of severity of, or how much treatment they should get.
How much what they should get?
How much treatment, how much intervention, how much treatment.
Okay.
So if a youth is scoring very low on their risk to reoffend,
Yeah.
then we would recommend to the county attorney to issue just a warning letter to not go on formal diversion.
0 to what?
0 to 4. And so there's some flexibility in there. They may show kind of a high need in one area in there, you know. So it's a case by case based on that child's need, but definitely that there's some kids who do not go on diversion because they have the warning letter, and those are listed there. Youth diverted from the system in warning letters. It is listed there. You can see that 233 warning letters were issued last year, so.
So, Sean, let me build on this question. Why would, just give me an answer, why would the assessments and the referrals not match?
This is a snapshot, so between the dates of January 1st and December 31st. So there were some kids who were referred the year before that were assessed on January 1st. And also, all kids don't get assessment. There are some kids who do not come to the assessment. They would refuse or no-show. There are some kids who may pick up a very serious charge before they get to assessment and be detained and therefore not come. Moved out of jurisdiction. Sometimes we find that families move between the time of the events, and that has happened. So there's a drop-off between the number referred and the number assessed, and that's going to happen year over year.
How long is it taking to get to assessment now? You know that?
I don't have that. I'll have that on my annual report for you guys. I'll have the time frame there.
Okay. Point me, I'm trying to find it quickly. Okay, truancies received. So, you haven't done that number for 18 yet? Because does it cross the school systems or?
Well, the number.
Or cross the school districts?
The number here, just the number here was only through December 31st. So I just wanted to give a quick update that so far.
No, that's what I mean, because it
right.
crosses, you're doing this on the, not the county, but the school.
The school year,
Okay.
right. And we'll, you know, if there's an interest in having more detailed truancy information brought, we have that, an entirely separate sheet full of truancy information. So if that's of interest to the board members, we can certainly bring that information.
So, you know, the question I asked, so like the number always used to seem like it hovered around 15, but now like the top number on one is down. And it's trending like it was in 17, it was 1309, and it went down. But it's safe to say that capacity of truancy is putting the balance back in, so you're realistically treating, roughly 2,900 with
Right.
the truancy, okay.
Right. And there's nuances with each of those, so,
Okay.
yeah. Just a quick note on training, if no one else has anything on the data. We're doing lots of training right now. We're fully staffed, and we're gonna be, we have a YLS training, and again, that's our risk assessment. We've been trained at different points in time and through different trainers over the past 15 years. We're bringing in a trainer so that we're all up to date in the latest validated instrument, and that we'll all have very consistent training. So that's gonna be taking place this month and next month over 4 different dates to get everybody fully trained and certified. And in addition to that, the Juvenile Justice Institute at UNL is doing a local validation study. So they're taking 5 years of our data and validating that instrument on our local population.
When they do that, what would I do?
That will, right now, we don't have anything that says, so that YLS is the most researched risk assessment instrument in the United States for youth. So there's all kinds of studies that say it's a valid instrument, but we don't have any studies that say in Douglas County it's a valid instrument. So JJI is doing that. It's in conjunction with the diversion subcommittee, because across the state of Nebraska, different assessment and diversion programs use different instruments. And so there's an interest in saying what really are the effective instruments. That way we'll have a locally Nebraska grown validation.
Okay, when she looks at this, are you hearing anything in regards to some people think the YLS is too much?
I have definitely heard people say you shouldn't assess all kids. Definitely have heard that, right?
What's your thought on that? I mean, I haven't heard that, but I've heard that there could be a lesson in YLS.
That's part of the study. Part of the
Okay.
study is it needed. That's absolutely one of the reasons we're doing that.
Okay. Okay. What?
I want to ask you, are you the, what is your role in placing children in, I don't know, I guess what I've been calling them is alphabet agencies, for lack of a better thing. But what is your role in referring children to an alphabet agency? Say there's a really terrific one in Minneapolis and stuff, and we want to replicate it. They only have 4 kids in it, in spite of the millions of population. Have you been involved in looking at those agencies, or what do you have to say about that?
We don't have a role in those. I believe you, when you say alphabet, you're talking about ATDs, the alternatives to detention.
Oh, yeah.
I want to make sure that
Yeah.
we're speaking the same
Well, I'm
language.
talking about all,
No, he's
every
talking
place
about-
that, every place that a child could end up.
Right,
He's basically talking about alternatives. He's talking about alternative to,
Yeah.
but anything that
Yeah.
will basically keep a kid out.
right. That we're not referring kids as an alternative to detention, because we're not referring to detention. That's not a part of what we're doing.
Okay.
We're attempting to help kids get served without going to the court process.
Okay, diversion,
And
totally,
yes.
not going
Yeah.
part of all.
Right.
Got it.
You had mentioned that
Other side.
before at another meeting.
Right.
So I'm gonna,
That's right.
I'm gonna lay it out because I need to do this myself, so I'll make sure I'm clear. Kid gets, does something, goes to the county attorney. The county attorney determines the process, and the county attorney will determine if it goes to you.
Correct?
Okay. There is a chance that the kid goes to you, they don't formally even touch the system. Kid goes through it to be wiped clean. But if the kid doesn't live up to diversion, after whatever graduated levels you take them to, they could end up getting filed on to some degree.
They could.
Okay. And then once they do that, they're into that process.
Right,
Okay.
and so our role there is to really assess them for needs, to meet those needs, to try and keep them from going to that graduated level,
Yeah.
for sure.
Then not, if they get there, then they have to go through all the other stuff. Anybody else? Okay. Jada, I don't see Shelley, and I don't know if you're not. Okay, no. But just let me say to the board, so you'll be able to look out for it on the 30th. That quarterly data memo is done, so I don't know if you recall when Shelley Shelley Salter now. She comes before us and she'll give you the quarterly makeup of what's there, so that's done. And I'm just saying, be on the lookout for it on April 30th, and I asked if she can do that. So, with that, D is OIS, Janae.
Thank you. Last meeting, I reported that we had received community-based aid funds to do video vignettes of the system points, and today I was advised that the Crime Commission has, denied that request. So we are in pursuit of, alternative funding. We're not giving up. We're gonna get this project done, but it is on hold, and I know we were gonna talk with the families and parents and all those things too, so stay tuned. We're gonna keep chasing, this project down. We're gonna get this to happen. And then, any questions about that piece? And then the only other thing I have are some information regarding events that are coming up that would be of interest to many people around this table, I believe. The DMC RED group, don't want to steal any of your thunder here on Jamal or Mark. Exempt from, talking about it to actually action. Strengthening, Coalition RX, they're actually a nonprofit in the Community Engagement Center at UNL with us. And they are having an event, for classes, not I guess, an event, classes for ages 10 to 14-year-olds. It's a 7-week program to create positive engagement in the family environment. So, many of you can put, if you wouldn't mind putting those up at your locations or sending those out. Reconnect is hosting a reentry awareness resource on Monday, April 22nd. Tables are available for any providers or system touch points that would like to have representation there. And the last one I have is the Tim Polk Second Annual Juvenile Justice Forum is April 24th, April 24th. And it looks like quite the panel there. Mary Bison's gonna be on there, Honorable Vernon Daniels, Senator Tony Vargas, Dr. Ann Hobbs, and Marlon Wolford of Nebraska Support Network. So these are all juvenile justice related for folks. Lots going on Springs here, so let's go. Here we go, full force.
Questions?
Yeah,
Can I ask a question about the first one, continuing RX or something?
yeah.
How do you find the participants? Where do they come from?
Word of mouth, and then they get a hold of there. That's why we're trying to get the information out to as many of our stakeholders as possible.
So are these kids that are in trouble, or what's the deal?
Could be, could not be. Could be, we really want to try and get on the preventative side, so we have these programs and classes and any interventions we can put in place before we even get to the JAC or to the county attorney.
Thanks.
Yeah, you bet. Any other questions?
Do we have anything directly, or you just kind of one of the people helping?
Just one of the people helped, one of our partners there at the Community Engagement Center that we saw a connection with preventative stuff in juvenile justice.
Okay, so no questions. Go to the next item, which is the update on LB 67, LB 1112. This is the law change that we've been talking about that was passed last year. We implemented January 1, so I asked Mary just to give an update on process and where we're at, and anybody can ask some questions on programming and how they go about it. So, Mary, it's on you. Have you want to start?
So, before and since the law was passed, we've been working on trying to implement all sorts of different programs to keep kids out of detention and keep them to be served in their homes and in their natural communities. So we've expanded a lot of our in-home services across the state with the use of multi-systemic therapy and in-home providers. We've also participated in the discussions with the University of Nebraska Medical Center that Brad and Mark referred to, with the enhanced services with the psychiatrists and therapists, and good handoff of children coming from DCYC and going to participate in the Charles Drew Center if they're eligible for that program. We have been visiting with all of our shelter providers across the city in Omaha, to include Utah Holly and Child Saving Institute and Boys Town. and asking them to expand capacity. So far, Holly is going to add another 12 crisis stabilization beds, which will be open on April 30th. We are working with Child Saving Institute to implement a new service that will be called a reception center, which perhaps isn't the exact same kind of reception center that people might be familiar with that's used in other parts of the United States. We wanted to start out small, see how this would work. So we will do our lower level intakes at the CSI instead of at DCYC. So those kids that have the lower level misdemeanors, not weapons related or community safety related.
I'm sorry, I can't quite hear you. Lower level misdemeanors and then what?
Charges that are not, that don't involve a threat to community safety, so
Okay.
something like a shoplifting. We'll do those there. Child Saving Institute will also have a behavioral assessment, somewhat similar to the one that the diversion program uses, to try and offer services to the family voluntarily, because at that point it's a voluntary participation. They'll do a follow-up in 48 hours if the family is open to that, to see if there are things that the family wants to implement to try and keep them on track or help support the success of their child. We are having some other discussions with agencies about expanding shelter capacity that we aren't in a place yet where they want us to share their identification, but we're still working on that. We've also expanded our kinship care, so children who have an aunt or an uncle or a close friend of the parents where the child could stay with them for a couple nights till the crisis has passed. We also have some therapeutic and enhanced foster care providers who participate in specialized training to take kids that have some more special needs. They might have some mental health challenges. What else? We've been working with the adult county attorney and the adult public defenders and defense bar to try and get them to expedite the progress of the kids who are sitting in the youth center waiting on adult court charges. So they tend to sit a long time when there are decisions being made about the prosecution and the defense of their case or their filings. So we're hoping that those legal people will pay closer attention to the kids that are there for adult court issues. Go ahead.
Are they working on it with the progression calendar like they do with the civil side?
Yes, there is a state case progression standard through the Supreme Court. So they have to meet the state statute definitions for speedy trial and things
Right.
like that, but we want them to even do better than that.
Yeah. So is there anything to make them do better than that? I mean, in a civil side, when I was active in trial practice, you gotta notice that, you have the come in and tell us whose depositions you're taking in 5 days and all that kind of stuff. So you couldn't, one time I
Right.
got a case that was 7 years old and it
Sure.
sat there for 7 years, some guy gave it to me. Anyway, so I'm just saying they finally installed this progressive, so that's similar to that? They're being told?
It's similar, I don't know that, I don't know what legal
It's probably-
consequences would happen if they
Well, it's
don't.
probably not as simple as that,
Right.
because there's a lot of things involved. Okay.
There are efforts being made.
Yeah,
They
okay.
get a lot of phone calls.
And the source of your children, is it, is there a,
I was just very offended by what you said, so I was gonna walk out.
not the first time. Anyway, the children that come to you, they're referred by law enforcement courts. Where are they coming from? You're on probation, is that it? I'm not sure.
So when the police arrest
Yeah.
and bring them to detention, that would be one way, but we also have kids that come to probation that don't go through
Yeah.
detention. Right.
Okay,
So
and,
both,
And how is that decided? Who decides that?
The
Cops
county
or you?
attorney.
Who- County attorney?
county attorney files charges.
Okay.
Mary?
Mary, can you talk a little bit about the pilot you're doing for the in-home wraparound?
Sure, so that's the in-home services that we started about a year ago with multi-systemic therapy, which is a national model. We had put out RFPs for providers, and we had 2 agencies respond, Paradigm and Boys Town. And they have trained therapists to support parents and the child in their home. Each therapist has a caseload of 5 families. They're available 24/7. So they're brought in when we have a family who's willing to have those services in their home and work with the family to support whatever it is. If it's we don't get along, if it's mental health problems, substance abuse problems, if it's parenting, and then they will work on all of the needs pieces. So if that family needs a washer or a dryer or help with the rent or all of the supportive pieces to make sure those are not impediments to the success. School, they work closely with the schools, with the courts. We started out very small with that, with 16 families, and now we're up to almost 100. And then there's a little bit of a lower level of that with an enhanced, it's called an enhanced in-home family therapist, and that we also had put up RFPs for that, and Boys Town responded with that. So that's a similar, but it's not a clinical therapy service, it's more of a smaller caseload, but a supportive person who gets to know the family very well, is providing supportive services, but not necessarily therapy.
And so the pilot was started, is it a 1 year, 2 year, or is it kind of past the pilot now?
I think yes, so
Okay, good.
we're doing a developmental evaluation now. I think we're past the pilot stage, and this will become part of our permanent services because it's working very, very well. Our out-of-home numbers have decreased substantially in the last year. In fact, by about 33%. So I think not only is it better for families to serve kids in their natural environments, it's more cost effective. So I think we'll see that grow quite a bit as long as we are able to continue to have agencies that can hire the therapists and meet the needs of the entire community with bilingual therapists and cultural competence and things like that.
I've said over and over and over, those wraparound are important because a lot of times it's not just a kid problem.
Right.
And actually, so the youth problem stems from most of the time another problem
Right.
within the family unit, and so this is great. That's good to know. Thanks.
Kind of following up on what Mary Ann just said, do the families, do they find your services intrusive, or do they really go with the flow, or do you ever get out of my house? Or
Absolutely. Yeah, we have people that don't want us at all. That will, you show up at the doorstep and they don't let you in. That's true.
Okay, so
That does happen.
That's just a lost cause then, right?
Well, we're always gonna keep trying.
Yeah,
We'll
but I
keep
mean-
trying. We might send a different therapist, we might send a different probation officer, we might grab a community partner, we might find out who supports them in their, maybe they belong to a church, or maybe the child identifies a teacher.
So you don't give up on them, you keep pushing?
No.
Okay, good.
No, we don't.
Okay, well, I was just curious because, some of those things, like I thought, people don't want to open up their doors to
Right.
strangers.
Right.
And what are you finding on it? I mean, are you finding surprise like domestic abuse? Are you finding children that are, without food? I mean, what are you finding? What are some of the problems you're seeing? Everything under the sun?
Everything. Every family is different.
Yeah.
Everything.
How do they respond to it? I mean, if you have a domestic violence case going on, and what happens? I mean, what if you see a woman getting beat up in front of the kids? What do you do?
We would call law enforcement
Okay.
and
should
support
be a-
services and child protective services. We're required by statute
Well, that'd
to
be
do
kind of
that.
a chilling effect on getting you in the door, isn't it?
Well, it sure would be, but we're required to keep people safe.
Yeah, I
That's it,
understand that. I was just curious how that's really working.
yeah. Right, but overall, when the families do want us there, it works
Yeah.
very well.
I would think so.
Most people do want to support the success of their child.
And you can help them with just everything, like food and...
Pretty much. I mean, Omaha has a lot of resources.
Okay.
A lot. We have a lot of food banks. We have a lot of generous
Yeah.
people who are able to provide for needs.
Tell me about the funding for this. Is this Does it end pretty soon, or what's the deal?
No, well, the initial training, the training for MST is very expensive, so the initial training costs were paid for by grant.
Okay,
But the services themselves have been paid for by the state.
okay, thanks.
Mary, explain a little bit, just so people understand your process in how to expand services to a kid and a family in juvenile court, because it's, like you said, it's specific. It's not like programmatic, you can do what you, and like, can you open that up a little bit?
So when the kids come to probation, we are doing the assessment, we also use the YLS, and we did have, the University of Nebraska at Lincoln validate that for us, across the state with juveniles. So we are identifying the services and needs and have some other tools that we use, specific to the nature of the case. So after we do that, we are, and during the process of that, we're meeting with each family, teachers, getting input from anybody who has worked with this family to support their success, to find out what's already been tried, what they think, what they would like to do. We are asking parents and the child to, I'm sorry, I keep turning my back to, what they want. There's certainly, to your point, Mike, about families who have had a lot of services and they say, we already tried that, we don't wanna do that anymore, we wanna do this instead. So we're gonna try pretty hard to meet them where they're at, and bring in, again, the pieces that are specific to what their needs are. So if it's mental health, if it's substance abuse, if it's education, same thing with the dyslexia or the learning disabilities, or is it another advocate for a child to succeed with OPS? Maybe there's something that got lost between 8th grade and 10th grade. The bottom line is we're there to find out what's driving the behavior, with the family support.
I have one other question. What about, trauma? Do you get involved in trauma-informed events and all that? What
We do. We started the trauma training in 2009, so all of our staff across the whole entire state have been trained, and we have like a 101 level and
Okay.
trauma 1, 2, 3, 4. I think there are also a number of service providers in Omaha who have all had the trauma training. We did that in Douglas County in 2004.
Couple times.
Yeah, so all of the
When
stakeholders.
you said 2005?
I think
9.
2009 is when we started in, but Douglas County has had, so we've had it at the state level, we've had it at the local level, all of our providers are trained, we've done it in the schools, CYC, the county attorneys, public defenders, everybody's had quite a bit of trauma training.
What about public school systems or the Catholic systems? Do they get involved in with the trauma, or are they just not, they don't do that?
No, I think they're very involved in that. You know, we were at a meeting last week that there were several school officials who talked about that.
And one last question about trauma. Are you finding that when you're treating the children that sometimes the parents or the mother or somebody's been traumatized?
Yep, yes, and we do make referrals for the parents as well, whether it's trauma or whether it's, we do make a lot of referrals for jobs for parents,
Okay,
anything.
thank you.
Speaking of the trauma-informed, Region 6 has also had trauma-informed care trainings, but there's also that big grant that Match got, the Metro Area Continuing Care for the Homeless. And there's 3 trauma-informed trainings, and I sent it out to everybody in county government, you probably got it too. But Wednesday, April 3rd at Abide Ministries, Thursday, April 4th at Abide Ministries, and Friday, April 5th at Overload Mission. So that's another,
Right.
they're from, during the day. What was I looking for? I'll find it, and tell you in a minute, but,
Tell me too, will you?
yeah.
Please.
Hey, so Mary, explain, hey, you're alluding to it, but,
9 to 4,
oops,
sorry.
you're alluding to it, but, so all the meetings I'm in with you all, you're using the term, I guess to explain, I guess the authority of parent choice and voice in what you're doing.
So the children on probation all have parents. We do have some that have legal custody. We have some children who have grandparents or aunts and uncles or a different legal guardian. We do have about 50 kids that are duly adjudicated, meaning that Health and Human Services is their legal guardian, so they're wards of the state, but they're also on probation. But the majority of the kids that we have on probation do have parents, and the parents participate from the very beginning. They're contacted when we do the intake. They're contacted at the predisposition investigation. They come to court. We do family team meetings with parents. We do the school meetings with the parents. So when we're doing home visits, parents are there. They're involved with treatment teams if the child's participating in substance abuse or mental health or other treatment specific to their behavior. Their parents are required to participate in that, and most of the time they do.
So, I'm gonna just lay this out there so you can know, I mean, I've had this conversation with you and Mary Ann, but, so what you, explain to just everybody so they understand this deal, when a kid join, whose jurisdiction are they in?
Yes.
To move them?
To move, so if they're awarded a state, typically it is the Health and Human Services who will make decisions about what happens next. If there is a change, if they're living in a foster home, or if they're living with a grandparent, or if they need to go to a treatment facility, it's usually Health and Human Services that will have the jurisdiction of the ward, yes.
I just bring that up because I had a conversation with Mary Bisick and Mary Ann about and I'm just saying a meeting that I had with some people from Promiseship. Ironically, the meeting they had with me was asking, you know, the county's help in supporting funding-wise for services. And I kind of laughed and I said, you know, I thought the state was supposed to pay for all this. And their comment was the state's paying for the case management pieces, but the services, they fall into their own deal. I mean, one of the things they brought up was the running to the Medicaid management piece that you happen with the providers that need to clear that. And, you know, I just told them I got to think through this some more because I didn't want them to come to the board and be subject to your wrath. And I
They just ask questions. That's all.
No, but I told them on this they're gonna get an earful. But the other thing they asked that I was told about that I asked about to them, and I'm just saying it's curious to some degree, and just to flesh out a little more is that. So I asked them. It was told to me that you all have people that are there, and you're lobbying the county attorney's office for a delinquency charge because there is no service. They didn't deny that. They didn't say yes. So I don't know what's at the cause of all of that, but I just bring that up to know that's something that's flow that I don't have a grip on, and I don't, you know, I'm just telling you, I just told them I can't, you know, I just told them you're in a bad spot state-wise. I mean, you don't want to come for the board right now and ask about that deal. But just so you know, when you brought that piece up, I just figured I needed to lay that in. So, lastly, 2 more points. Just give me your philosophy on where I know I saw some of Deb's, Deb Minardi, who took Ellen's place, who's the new leader. I saw some of her philosophy on where she's going. I don't know if you want to give us a little enlightenment on that, but also your own philosophy on bubble wrapping kids, because this is what we're trying to get to. And so if you want to lay that out there.
So our new leader, she has 5 top priorities, and number 1 is juveniles. And within the juvenile arena, our focus is to do a better job of keeping kids at home, out of detention, out of state placement, to identify what we can do better all the time to serve kids in their homes. What Commissioner Rogers is referring to with the bubble wrap piece is Nebraska is one of the few states who files charges on status offenders in juvenile court. Most states serve status offenders, and status offenders, I mean truants, children who are determined to be ungovernable or parents are asking for help. Most of the time states are serving those kids that are they're not filing child welfare charges on them, and they're not filing delinquency charges on them, but they're kind of an in-between spot where they work with mediators, they work with case managers to support family success without having the court involved at all. So that's one piece where I'm supporting with people who are interested in pursuing that as a better way to serve kids, because certainly what we see is that when you bring a child in who has needs, for example, if they have educational needs or something going on in their family where they're not attending school, that's a different scenario than a child who is a threat to the community safety. So we don't want to mix those kids in any services, we don't want to have them in places together, we don't want to have them in groups together, we don't want to have them in therapy together. They're different needs and different services that need to happen, and it would even be better if we could separate them and not have them filed on entirely. So I think sometimes what we see is people want to find a way to pay or force the family to get services, so charges are filed, and then we see them up on the 6th floor, and that's not necessarily the best place for them to be.
Has any effort been made to change state law, what's going on with that?
Well, there are lots of discussions
There's
about
a lot
that
of discussion,
statewide. I
yeah.
think Senator Vargas is interested in that, I think Pansy Brooks is interested in that.
What's the opposition?
I think it's just timing right now about everything that's going on. They're talking about it. I wouldn't be surprised if this comes up next 2 years.
And I think there's a tendency for people to think that that's a way to keep kids safe.
You put them in juvenile detention?
Or
Well,
not.
now what she's talking about is like Brass State Force, there's no status offender.
There's no status offenders in
No,
it.
but what you're talking about, doing what now?
So they're concerned sometimes.
What do the other states do?
They have kind of an in-between.
Yeah.
That's not child welfare and
Right.
it's not criminal justice, so it's an in-between.
Right.
They use a lot of mediators, they use case managers,
Uh-huh.
they use service providers, they get kind of buy-in from everybody in the community to support, this is how we wanna treat these families. We don't want to have them involved, we don't wanna have to have them appear in front of a judge.
And why can't we avoid that now? Is there, are the attorneys being too aggressive, or the county attorneys? What's causing it?
I think it's a culture in this whole state. It's not necessarily specific to Douglas County, but
What
it's
trigger-
just the way that,
What triggers it?
I think, I don't know if I can answer that, without,
I'll take up.
Offending someone?
It is, I think
That's why I ask nagging questions.
well, no, I think the trajectory of it, I think LB 1112 is a piece of that. There's things that's been discussed in the points, different decision points, judiciary has a big stick on that. So 1112 was one that, as we said, it's programming piece, but it's also statutory change, and that's one. This is one that I could definitely see coming because I think I told you all this. I saw this, we were at Georgetown, we saw this number, that Nebraska is number 2 in the country with like 250 kids on, that status offenders on probation. Now, I don't know how old that number was, but I actually the number here was more like 225 or something like that. But the thing is, if that statute ever gets changed, what it does do is it puts those kids into another realm of getting services, and it relieves the pressure here, so that they have more time to really handle some more ruthless, more intense,
safety issues.
intense deal. And the point is, it's the juvenile piece is all about managing risk for where a person is. So, if they're able to put more hands-on attention to them, that allows more stuff to happen and mitigate the risk. These kids that have started out on a status offense don't need to be soaking up all that service. We can put them somewhere else, but the law change makes it more definite and doesn't leave it to discretion.
I think it's a good start.
Yeah. Is that a more political way? That takes you up, okay. Which is where you're trying to get to. But.
Yeah, it seems to me like that'll be a real priority of ours. If it isn't.
There's a couple people working on it. I wouldn't be surprised if it moves quick. So Mary, my one question to you. So what the stuff you're working on now to try to get ready, what's the one issue you're having trouble with that the board can help you unblock? Service-wise, is there a service you need that that you need, that we can try to help unblock?
New or capacity building. New or capacity building.
Yeah,
I
whatever.
think we've had really good support from all of the agencies that we've approached to ask for expanding services. I mean, we've got now 7-day and evening reporting centers. We have certainly seen a culture change with law enforcement in terms of who they bring to us. All of the places that we have talked to are pretty open to doing this. They just wanna make sure that it's gonna be fiscally stable for their agency, which I think is fair, so. There's funding, we, because of the fact that we're spending less money on out-of-home services, you know, that frees up money for more in-home and more local places.
Can anybody here tell me how Utah Holly and CSI and I guess the Omaha Home for Boys suddenly popped up as sites that can take the pressure off? Anybody know anything about that? Shed some light on that? Did it just
For
pop out?
because they already offer the continuum of care services, because they already had shelters, they already have places, they already have clinicians.
So but it's expanded because the
They need capacity.
foundation
they need
asked, is
support.
that it?
They need support for capacity. I think they have some of them have got some startup to do this pilot from some foundations, but it's fair to say that the direct drive for this all for, I mean, you've been working with them, but this last year with LB11's passing, it's been a whole deal. You had to go out and get ready for this, so,
Right.
some people.
Well,
Well, Utah Holly is privately, it's a corporate funded place.
See, and that's, when I heard that Sherwood was doing this with the Omaha Home for Boys and the CSI and whatever it is, the CSI, yeah, and Utah Holly, my first question was, you know, who's paying for it and for how long? And what services, you know, cause we've been, I mean, you know, it'd be nice, it's nice they're doing it, but we don't wanna, a year from now, find out we've got
Well,
a
CSI,
big bill.
CSI got there to
We
start
pay,
up,
the
but
state pays for all that anyway.
Okay,
You
well,
don't pay for, county doesn't pay for any.
okay, well, what was Sherwood's role in that then?
they helped start some of them, help get it piloted up. But CSI is,
When you say pilot, that means they gave money, doesn't it?
yeah, to help get it started, but you're concerned about sustainability. They pay to some degree, but also, they're on board to get, CBA money for this process to start in July of
CSI.
19. Yeah, CSI. So that's the stable part that part comes up.
Yeah,
Like
we
you said,
pay
Utah
for all
Holly's
the
corporate,
shelter
they pay for that.
placements, the state pays for all the shelter placements, all the day evening recording, all
So
the.
Sherwood didn't put any pilot money in it?
Sherwood has money that they gave to CSI to
Oh, okay.
start, remodel the reception center,
Okay,
basically, that was it. That, it doesn't pay for any of
Yeah,
the ongoing
Not service.
services. And they did not give any money to Utah Holly.
yeah.
That's
Through Holly's corporate.
Have there been any discussions with the youth center regarding anything that Mike's talking about? For placements outside of the system and these private
Oh, we've
committees?
known that they're looking to enhance or improve or increase capacity for shelters and some of the other programs that Mary has talked about, yes.
They've talked to you? They've come in?
I don't know that we were made aware, yeah.
Okay, but there haven't been formal discussions about this. And my question is predicated on the fact that the children under your
No,
care.
they're not under his care. They control entry.
I'm sorry, I wasn't done with my question with this fellow. The children under your care are pretty much there because the courts have put them there. And
Well, they
the
go through
county attorneys filed.
law enforcement and
Right,
intake
right, right.
and the county attorney.
So, I mean, you're not laterally free to allow them to be placed in another institution, isn't that right? Without a court order, you can't put them someplace else. Right. And those discussions would involve the county attorney and the courts and you relative to where they're gonna go.
We would be the last to know.
They don't have any
That's
role.
kind of apparent.
There wouldn't be any need to talk to them about that really, because you're just the gatekeeper. You just house them. You don't have any decision making in where they go. Right.
Which to the point is trying to make is that they've said it every time we try to say it, They don't control who goes in and out. They control who goes in and out. That's why the discussion of the program piece has been there with them in the court. So they're making them aware, but they could say yes or no to anybody coming out at all. That's all right here. And that's why the partnership with the state is important, because we don't have a lot to say, but we need to work together to make it happen.
Yeah, I guess my point is that these children are there for a specific legal purpose, and they're in an organization, the youth center, that has specific requirements from the law and from certifying agencies that these other private corporations do not enjoy. And so discussions with them might be, I think, a condition precedent to following the legal way, if you were going to take children out of their care and put them someplace else. None of that apparently is going on. It's
And
clear.
that's not an accurate description. Because
Okay.
as it said, they have no control. The only thing they do by that point is the containment piece. This is where the game is right here.
Right, right. Yeah.
So that's a public entity making the call. Anyone
Right,
else?
the courts make the call of who
Public
goes there.
Public entity, and it's
Right,
not them.
and so the children, their population, which is today at 80, what is it? Today? 83, are there because courts, legal entities that have control over these children, put them there. Legal entities, not private corporations, are gonna have control if these children are to be placed someplace else. None of those legal entities are here, and I'm just pointing out to you, this talk is great, but without legal entities taking actual legal action, none of that's gonna happen.
But they're talking to the courts, every program that they're talking to, they're talking with the courts and getting their deal with that. So it's fair to say that they're actually a jurisdictional entity. Anyone else? Thanks, man. So I sent you an email trying to work and see if you can do this on the 30th, if you get it now. Set it up. Okay. With that, that's item 2. Any other unresolved business? Okay, with that, we will back together in May. Just know, you should be on guard in May. That's budget cycle, and hopefully we have to yield to the budget if that's that, so everybody will be on notice. Thank you.